A silent risk in daily habits. If you're over 60, chances are you've been told at least once that taking vitamins every day will keep you healthy, strong, and sharp. Maybe you line them up on the kitchen counter each morning. Or maybe you take them before bed, thinking it's just another way to protect yourself. But here's the truth very few people talk about. Some of those healthy habits can actually raise your risk of a stroke while you sleep. No pain, no warning. One night you feel fine, and the next morning you wake up with slurred speech, a weak arm, or the terrifying loss of balance. As a doctor who has spent years working with older adults, I've seen this story unfold more times than I'd like to admit. The surprising part is that it's not usually because of smoking, poor diet, or skipping exercise, things we all know can hurt the body. Instead, the hidden danger often comes from something far more innocent: vitamins taken the wrong way, in the wrong dose, or at the wrong time. Millions of seniors across the US swallow supplements daily, hoping to protect their bones, boost energy, or keep their memory sharp. And yes, many vitamins can help in the right amounts. But when the dosage is too high or the body can't process them properly, the results can be quietly dangerous. That's when supplements, meant to help, become a risk to your brain. In fact, research has shown that certain vitamins, when misused, can increase the chances of stroke, brain bleeds, blood pressure spikes, or even permanent nerve damage. The most concerning ones for seniors include vitamin D, vitamin E, vitamin B6, vitamin A and niacin, vitamin B3. Each of these plays an important role in the body, but in high doses or with certain medications, they can turn from helpful to harmful without you ever realizing it. This isn't meant to scare you, it's meant to open your eyes. Because awareness is power, and the earlier you understand the risks, the better you can protect your independence and quality of life. So let's take a closer look at these vitamins. Starting with one of the most surprising, vitamin D. Most people think of it as the bone protector. But in the wrong dose, it can set the stage for a silent stroke in the middle of the night. Vitamin D, from bone protector to brain risk. When most people hear about vitamin D, they immediately think of familiar benefits: stronger bones, a stronger immune system, even a brighter mood. And that's true. Vitamin D is essential for calcium absorption and maintaining bone density. Doctors often recommend it, especially for older adults who don't get enough sunlight or who are at risk of osteoporosis. But here's the hidden truth: if taken in the wrong dose or at the wrong time, vitamin D can shift from being a vital nutrient to a silent threat to your brain. Take the case of Walter, a 74-year-old retired Navy veteran. Every morning, he carefully lined up his supplements, including a 10.000U vitamin D capsule he had purchased over the counter. He truly believed it was protecting his bones. What he didn't realize was that his body was slowly accumulating dangerously high levels of calcium. One morning, his wife found him confused, struggling to speak, with his right arm hanging limp. He had suffered a stroke in his sleep. Tests revealed critically high calcium levels, hardened arteries, and unstable blood pressure, all classic signs of vitamin D toxicity. So what happened? When you take too much vitamin D, especially without medical supervision, your blood calcium levels can rise far beyond what your body can safely handle. Instead of being absorbed into the bones, the excess calcium deposits into your arteries, making them stiff and narrow. In older adults, where blood vessels are already less flexible, add in dehydration and poor sleep, and you've created the perfect storm for a clot to form and travel to the brain. The most frightening part is that there are usually no warning signs. You can go to bed feeling perfectly fine and wake up with a stroke that changes your life forever. Meanwhile, many vitamin D supplements sold in the US contain far more than older adults actually need: 5.000U, even 10.000U. Countless seniors take these daily, thinking, more must be better. But research shows that even 2.000U per day may be too much if you're not truly deficient. That's why knowing your own numbers is absolutely critical. If you're taking vitamin D, Especially combined with calcium or heart medications, you need to get your blood levels checked regularly. And always take it in the morning, never before bed. Timing matters more than most people realize, because calcium spikes at night can create a dangerous environment for your brain. Vitamin E, the heart helper or a silent bleeding risk. For decades, vitamin E has been marketed as a heart helper. You'll see it on supplement bottles promising better circulation, sharper memory, and even healthier-looking skin. Many older adults add it to their routine without hesitation, believing it's a safe and natural way to protect their heart. And while vitamin E does play an important role as an antioxidant, high doses can quietly turn it into one of the most dangerous supplements for the aging brain. Here's why. Vitamin E acts like a natural blood thinner. That means it slows down clotting, something that sounds beneficial if you're trying to prevent heart attacks or strokes caused by clots. But in reality, when combined with common heart medications such as warfarin, aspirin, or Plavix, too much vitamin E can tip the balance too far. Instead of preventing clots, it can make your blood so thin that even a tiny vessel in your brain may rupture. The result, a hemorrhagic stroke, bleeding inside the brain that can be far more devastating than a clot. Let me share Evelyn's story. She was an 81-year-old retired librarian from Ohio. Sharp, witty, and always with a book in hand. She prided herself on taking good care of her health. Evelyn had a heart valve condition and was already on warfarin, a prescription blood thinner. Her doctors carefully monitored her blood work, and everything looked stable. But then she saw an ad for natural vitamin E, and decided to try it. Each capsule contained 800 U. 3 weeks later, she was rushed to the ER with a severe headache, vomiting, and confusion. A brain scan revealed a hemorrhagic stroke, bleeding caused not by high blood pressure or trauma, but by the dangerous mix of warfarin and high-dose vitamin E. Most people don't realize that the recommended daily intake of vitamin E for older adults is only about 15 mg, roughly 22 U. Yet many supplements on store shelves contain 200, 400, or even 1.000 U per capsule, with no warning labels about the risks. Seniors often take them daily for years, thinking they're helping themselves, when in fact they may be increasing their risk of a brain bleed. Evelyn survived, but she now uses a cane and struggles with short-term memory. Through tears, she admitted, "I thought I was doing something good for myself. I never knew I could be doing harm." Her story is a painful reminder that not all vitamins are safe, especially when combined with heart or blood pressure medications. Before adding vitamin E or any supplement to your routine, talk to your doctor. It could save your independence or your life. Vitamin B6, when nerve support damages nerves. Walk into any pharmacy aisle and you'll find bottles labeled nerve support, brain booster, or energy formula. Many of them proudly list vitamin B6 as a key ingredient, often in very high doses. Seniors are told it will help with focus, memory, or tingling in the hands and feet. But here's the little-known danger. Too much vitamin B6 doesn't strengthen nerves, it can actually damage them, sometimes permanently. Consider Harold, a 76-year-old retired truck driver from Kansas. He came into my office complaining of numbness in his feet, tingling in his hands, and trouble keeping his balance. At first, he thought it was just arthritis or the normal aches of aging. But the symptoms got worse. He started falling, first once, then again, until he hit his head on the bathroom floor. When I reviewed his supplements, the culprit jumped out immediately. He had been taking a nerve support pill for over a year, with each tablet containing 100 mg of vitamin B6. He was taking 2 a day, 200 mg daily. That's over 10 times the safe upper limit for older adults. Here's what happens. Unlike some vitamins that flush out easily in your urine, vitamin B6 builds up in the body over time. In large amounts, it strips away the protective coating around your nerves, much like peeling insulation off electrical wires. The result is neuropathy, tingling, burning, numbness, weakness, even tremors or confusion. And here's the scary part: the damage can be irreversible if it isn't caught early. For seniors, the daily recommended intake is just 2 to 10 milligrams, including what you get from food. That's a fraction of what many brain and nerve supplements contain. Some bottles sold online boast 50, 100, even 200 milligrams per tablet, levels that can silently poison your nerves while promising to protect them. Harold was fortunate. We stopped the supplement before the damage progressed further. But he still needs a cane to walk and no longer drives. I thought I was helping my brain, he told me. I didn't realize I was poisoning it. His story underscores a critical truth: more is not better, especially when it comes to vitamins. If you take any supplement marketed for brain, nerve, or energy support, read the label closely, know your numbers, and before trusting the promises on the bottle, check with your doctor. Your nerves are too important to gamble with. Vitamin A, the vision protector, that can backfire. If there's one vitamin most people associate with eyesight, it's vitamin A. For decades, we've been told it's essential for good vision, immune strength, and even youthful-looking skin. Older adults often add it to their routine, believing it will help them age gracefully and protect against eye problems. But here's the unsettling truth: too much vitamin A doesn't just sit quietly in your system, it accumulates. And over time, that buildup can quietly damage your brain, your vision, and even mimic the symptoms of a stroke. Take Dorothy, a 79-year-old retired piano teacher from Oregon. She was independent, lively, and continued to give lessons from her living room. But one day, she began experiencing pounding headaches. Soon after came blurred vision, dizziness, and slurred speech. Her family feared the worst, a stroke. Yet when scans came back, there was no clot, no bleeding. Instead, she had elevated intracranial pressure, meaning too much pressure inside her skull. The culprit: years of high-dose vitamin A supplements for skin and eye health. She had been taking nearly 10.00 U per day, more than triple the safe upper limit for older adults. Here's the science. Vitamin A is fat-soluble. That means it doesn't flush out in urine like vitamin C or some B vitamins. Instead, it's stored in the liver, tissues, and even the brain. As we age, our liver becomes less efficient at clearing it out, so the accumulation happens faster. When vitamin A levels get too high, it can lead to a condition called pseudotumor cerebri, literally, false brain tumor. The symptoms: headaches, blurred or double vision, nausea, dizziness, and sometimes permanent vision loss, can look frighteningly similar to a stroke. What makes this even trickier is how easily seniors can exceed safe levels without realizing it. Many multivitamins already contain the full recommended dose of vitamin A. Add on a separate supplement for skin or eye health, and suddenly you're double or tripling your intake without knowing. The safe upper limit for older adults is about 2.50 to 3.00 U per day, and that's only if supplementation is truly necessary and done under medical supervision. Dorothy is recovering slowly, but she now needs regular eye exams, pressure checks, and therapy for balance. Through tears, she told me, "I thought I was doing something good for my body. I never imagined it could hurt my brain." Her story is a powerful reminder. Even vitamins with the best reputation, like vitamin A, can turn dangerous in high doses. Respect the limits, read the labels, and remember, more is not always better. Niacin, vitamin B3, cholesterol fix or brain hazard. Niacin, also known as vitamin B3, is often praised as a natural remedy for high cholesterol. For years, it's been added to heart health supplements, promoted in magazines, and even prescribed by some doctors. You'll also find it in fortified cereals and even energy drinks. Many older adults take it, believing it's a safer, more natural option compared to prescription drugs. But here's what most people don't know: in high doses, niacin can wreak havoc on your blood vessels, your blood pressure, and ultimately your brain. Consider Frank, an 82-year-old retired postman from Florida. He started experiencing strange episodes, flushing in his face, a pounding sensation in his chest, dizziness that seemed to come and go, especially in the mornings. His wife thought it was anxiety. His son blamed his blood pressure medication. But when we reviewed his supplements, the real cause became clear. He had been taking an over-the-counter cholesterol support pill, each serving containing 1.000 milligrams of niacin, and he was taking it twice a day, 2.00 milligrams daily. That's over 60 times the amount most older adults actually need. Here's what happens. Niacin causes your blood vessels to dilate, which is why many people experience the niacin flush, warmth, redness, or tingling in the face and chest. But shortly after, those same vessels can constrict again. This yo-yo effect puts tremendous stress on your cardiovascular system. The sudden tightening can spike blood pressure, trigger irregular heart rhythms, and reduce blood flow to the brain. Over time, this repeated strain is like tapping a fragile piece of glass with a hammer. Eventually, something cracks. Frank's outcome was a transient ischemic attack, or TIA, a mini-stroke, where blood flow to the brain is briefly interrupted. His speech slurred for 2 minutes before returning to normal. It was a warning shot, a reminder that what he thought was helping his heart was quietly endangering his brain. The safe upper limit for niacin in older adults is around 50 milligrams per day, and anything beyond that should only be taken under close medical supervision. But many flush-free or extended-release forms sold online still carry serious risks, even though the labels make them sound gentler. Frank is now off niacin and recovering well, but he admitted, "I thought I was doing everything right. I didn't know I was gambling with my brain." His story shows us the truth. Even natural supplements can become dangerous drugs when taken in excess. Respect the dosage, consult your doctor, and remember that your brain is too valuable to risk on a misleading label. Why real food beats pills? By now, it may feel overwhelming. Vitamin D, vitamin E, B6, A, niacin, nutrients we've always been told to trust, each with the power to backfire if taken the wrong way. So where does that leave older adults who truly want to protect their brain and heart? The answer may surprise you. It's not in a pill bottle. It's on your plate. Let's talk about Margaret, a 73-year-old retired school principal from Arizona. When I first met her, she proudly showed me a drawer packed with supplements: vitamin D for her bones, vitamin E for her heart, a B complex for energy, niacin for cholesterol, a multivitamin, plus a few more she had picked up from health magazines. "I'm doing everything right," she told me, yet despite her best efforts, she was dizzy in the mornings. Her balance felt off, and her blood pressure kept creeping higher. Instead of adding more pills, we tried something radical. We cleared the clutter. One by one, we set aside the supplements and focused on food. No expensive powders, no miracle blends, just whole, nutrient-rich foods in balanced portions. Her new breakfast looked simple but powerful: 1 boiled egg for clean protein, half an avocado for healthy fats, a slice of whole grain toast for steady energy, and a handful of blueberries packed with brain-protective antioxidants. Sometimes she added a few walnuts or almonds for an extra boost. To wash it down, a glass of room-temperature water to rehydrate her brain after sleep. Within just weeks, Margaret felt different. The dizziness faded, her blood pressure stabilized, her energy returned, and she told me her mind felt clearer than it had in years. The reason is simple. Our bodies weren't designed to thrive on megadoses of synthetic pills. They were designed to thrive on food, real, natural food that delivers nutrients in the right amounts, at the right time, with other compounds that help the body absorb and use them. Some of the best brain foods for older adults include leafy greens like spinach and kale, fatty fish like salmon or sardines, berries rich in antioxidants, nuts and seeds for healthy fats, and vitamin E and whole grains to stabilize blood sugar and improve circulation. These foods don't just protect your brain, they also support your heart, bones, mood, and mobility. The lesson here is clear. instead of chasing health in bottles. We need to return to the basics. Every meal is a chance to nourish not only your body but also your independence and quality of life. Key takeaways: awareness is medicine. We've walked through 5 common vitamins that can quietly put older adults at risk: vitamin D, vitamin E, B6, A, and niacin. Each of them serves an important role in the body, but when taken in excess, at the wrong time, or combined with certain medications, they can tip the balance from helpful to harmful. The truth is, it's not the pills themselves that are the enemy. It's the lack of awareness about how they really work in an aging body. As we get older, our metabolism changes. The liver and kidneys don't process supplements as efficiently as they once did. Arteries become less flexible. The brain becomes more sensitive to changes in blood pressure, blood flow, and nutrient levels. What your body could handle at 30 doesn't always work at 70. That's why even natural habits, like taking daily vitamins, can backfire if they aren't tailored to your needs. The good news: awareness is the best medicine. Once you know the risks, you can make smarter choices. That means, read labels carefully. Don't assume that natural means safe. Check how many U or milligrams you're really taking. Respect the limits. More is not better, especially with fat-soluble vitamins like A and D that build up in the body. Check with your doctor if you're on blood thinners, heart medications, or blood pressure drugs. Never add a supplement without medical guidance. Get blood work done. Knowing your actual vitamin levels is far more accurate than guessing or copying what someone else takes. Prioritize food. Nutrients from whole foods are balanced, absorbable, and safe in ways that high-dose supplements often are not. Think of it this way: your body at 60, 70, or 80 doesn't need mega doses. It needs balance, consistency, and support. The vitamins that once seemed like shortcuts to health can actually become obstacles if used carelessly. But with knowledge, you can flip the script. Every choice matters more as we age, not out of fear, but out of respect for the years ahead. You've worked hard for your independence and vitality. Protect it by making informed decisions, by respecting the power of vitamins, and by trusting the wisdom of whole, nourishing foods. Awareness isn't just information, it's prevention. And prevention is the most powerful medicine of all. Call to action and closing. Now that you've heard the hidden truth about vitamins, it's time to bring everything together. The message isn't to fear vitamins, but to respect them. These tiny capsules can hold both benefits and risks, depending on how they're used. And for older adults, the margin for error is smaller. What seems harmless, an extra pill at night, or a higher dose than recommended, can quietly set the stage for a life-changing event like a stroke. But here's the hopeful part: you're not powerless. In fact, you have more control than you realize. With simple steps, reading labels, talking with your doctor, testing your blood levels, and prioritizing real food, you can safeguard not only your brain but your independence, your memory, and the moments you share with the people you love. Think about it this way: every meal, every supplement, every choice is a chance to invest in your future. When you choose leafy greens, salmon, or a handful of blueberries over another high-dose pill, you're choosing clarity over confusion, stability over risk, and life over limitations. You're telling your brain and body, I care enough to protect you. So let me ask you directly, have you ever stopped to check how much vitamin D or E you're actually taking? Do you know if your nerve support supplement might contain 10 times the safe limit of B6? Have you talked to your doctor before adding that heart booster with niacin? These aren't small questions. They could be the difference between staying active and independent or facing years of recovery. I want to hear from you. Type 1 in the comments if you've ever wondered whether your vitamins might be doing more harm than good. Type 0 if this is the first time you've heard this perspective. And if brain health matters to you, or to someone you love, share this video so more people can be aware of these hidden risks. Finally, don't forget to hit the like button and subscribe to Health Vita. Together, we can keep learning, growing, and protecting not just our health but our freedom to live fully. Because no matter your age, it's never too late to take back control of your health. And remember, awareness is medicine, and prevention is power.